Hello everyone, and welcome back to another episode of Ask the Doctor. Today, we are discussing general surgeries, and with me is Dr. Ashley Pinette, a general surgeon with Northside Cherokee Surgical Associates. Welcome in, Doctor.
I am Ashley Pinette. I am a general surgeon at Northside Cherokee Surgical Associates in Canton, Georgia.
What type of surgeries does Northside Cherokee Surgical Associates offer?
We offer a wide array of services that include things like gallbladder disease, gallbladder disorders of the pancreas and the spleen. We offer services for diverticulitis and colon cancers, thyroid. We offer services for pancreas, stomach, upper GI diseases like GERD and reflux disease, things like hemorrhoids. We offer services, it's so broad that we're able to do many things, from gallbladder disease to skin lesions, anything that really you think might require a surgical consultation. It's a good idea to come and just sit down and have a conversation about it.
What is the difference between open surgery and minimally invasive surgery?
So most of the time when you do an open surgery, you're making a large incision. You would open up a cavity to explore or to do something with. So it's usually typically why we call it open. And you use long-lasting sutures to close the cavity up again. And so that usually is associated with a little bit of a longer recovery time, a little bit of a rigorous recovery period, because there's a little bit more pain as you heal a bigger incision. With minimally invasive surgeries, we have a few small incisions that typically don't require as much time to recover. Still sutures to close those incisions, but they typically heal a little bit faster because they're small and you don't require as much, or you don't go through as rigorous of a healing process for your recovery.
What are the potential risks associated with surgeries?
So every surgery has its own risk associated with it. Most patients will ask, just undergoing general anesthesia, Doc, what's my risk of not waking up? That's usually the most common question that I get when I'm in the office. And people are afraid of that. But I will say, since anesthesia has come such a far way over the last 30 to 50 years, they are able to minimize that risk to less than 1%. So it's 0.001%. So like 1 in 100,000 is what you'll find when we talk about that. Other surgeries, now as we discuss surgeries, each specific surgery has its own specific risk. So what I would advise anyone who's coming to see me in the office, or any surgeon for that matter, is you should ask specifically about the procedure that you're having done, or that you'd like to explore the option of having, and what those specific risks are. One surgery's risks or complication risks is not the same as another. And so each one is important to have that discussion about with your surgeon.
Should a surgical patient request a second opinion?
Surgeons, although we have feelings, we don't get hurt if our patients ask if they could go see someone else for a surgical second opinion. We actually encourage that. It helps, it's positive, it helps you to make a better decision when you're informed from multiple sources. Now, I wouldn't say go and get a second opinion from everybody in town, but I would say it's okay to go in and request a second opinion, as we would encourage that, and we think it's a good thing for you to help finalize or solidify your decision for surgery.
Why should we choose Northside Cherokee Surgical Associates?
So at Northside Cherokee Surgical Associates, the first thing I would tell you is that all of our providers care about you. We take the time, we listen to your needs, we listen to the symptoms that you're having, and if it becomes a surgical issue or something that can be handled surgically, we'll do our best to take the best care of you. In the office and in the hospital, we use a team-based approach to make sure that you get the best care possible. We have our board-certified surgeons available to take care of every single need that, from a surgical aspect, that can be taken care of.
Where are you located?
Thank you so much for listening. Feel free to come by and see us in the office. My office is located at 900 Town Lake Parkway in Woodstock. come give me a visit and we'll be happy to take care of you. Thank you.
This has been Ask the Doctor, presented by our friends at Northside Hospital Cherokee.